Welcome back. Stroke is the third most common cause of death in Hawaii and is the leading cause of disability in our state. And so a recent grant of nearly $7 million to help first responders, hospitals, and care providers save more lives. Joining us to further explain is neurologist Dr. Matthew Koenig from the Queens Health Systems and Community Impact Director Elizabeth Cotterell from the American Heart Association. Thank you so much for joining us this morning.
Yeah, thank you for having us.
Absolutely. So can you tell us more about Mission Lifeline Stroke?
Absolutely. So Mission Lifeline Stroke is a new initiative in Hawaii that's designed to expand the stroke system of care. It's being supported by the Helmsley Charitable Trust, and we're very excited to see how it's going to impact our state.
Can you explain how this impacts residents and why it's important for them?
Yes. So stroke, like you mentioned, is the third leading cause of death in Hawaii and the #1 cause of disability. And to compound that, we have higher than the national average for the rates of high blood pressure and cholesterol, which are two leading causes or two high risk factors for stroke. And so to compound that, over a third of our population actually lives in rural communities, which makes it hard to receive quick, effective stroke care. And so what this is looking to do is to really close the gaps, particularly for those rural communities, so that everybody, regardless of their zip code, can receive the care that they need when they experience stroke, that they can have the best chance of survival and the best possible outcomes.
Yeah, absolutely, because every second counts in these moments, right? And so to have like that fast response is crucial. Can you tell us more, when someone might be undergoing a stroke, what are the signs that we need to look out for?
Absolutely. It's really important that the public is able to recognize a stroke, not just if you're having the symptoms yourself, but if you see another person having stroke symptoms. It's incredibly important to call 911 because stroke care starts in the ambulance. As Elizabeth mentioned, we've really coordinated between the hospitals and the EMS system. So paramedics are able to recognize stroke. They only transport patients to hospitals that are capable of caring for stroke. They call ahead and activate the system. And that way, stroke professionals are available when the patient arrives in the emergency room. Actually, in many cases, we're seeing patients by telemedicine in the ambulance before they even arrive. And so we are truly starting that stroke care in the ambulance.
Wow.
That's predicated on people being able to recognize a stroke, though. If a person doesn't recognize that they're having a stroke or their family member is having a stroke and doesn't call 911, then they actually can't access all those steps of the stroke system.
And I mean, I did not know that, and that's actually super good to know. What are the signs for like a family member seeing this or you yourself suffering from it?
So we use an acronym called FAST, and that means asking a person to smile and then seeing if the face is droopy on one side. So that's F. A stands for arm weakness, so hold out your arms. If one arm drifts down, then that can be a sign of a stroke. S is speech problems, either slurred speech or trouble coming up with words. And T is time to call 911. So we say act fast for stroke symptoms.
That is super easy to remember. So face, arm, and speech, right, to look out for, and then time to call
911.
All right.
And if anybody experiences any one of those symptoms, even if it is temporary, we want to make sure that they call 911.
Well, thank you so much. That's super important to know. And yeah, thank you for being here and sharing all of that with us.
Absolutely. Thanks.
Yeah, thank you.